Joint replacement surgery is very common and becoming much more common. It is such a good surgery and it provides such a good amount of pain relief to people that it is a very common thing to do. It's one, total knees and total hips are probably two of the most successful elective surgeries for returning quality of life back to people. So it is done with steadily increasing frequency, especially as our patient population is getting older.
The goal of any total knee replacement is to provide a balanced and functional knee. And that's exactly what robotics offers, a way to precisely place components and implants so that you can have optimal outcomes. Conventional joint replacement surgery involves using intramedullary, extramedullary guides to assess proper alignment of your components, and then placement of jigs or cutting blocks that allow for proper cuts to be made that fit the appropriate implants. Robotic surgery is a significant advancement when it comes to total knee replacement because it allows the surgeon real-time data to place implants in the appropriate alignment and position that overall gives you a very great result in terms of balancing and overall leading to patient satisfaction.
The technologies have the potential to increase the accuracy of placement of the various components that you use for knee replacements. And as they become more and more accurate, they provide probably a better approach to doing these surgeries. So that's the goal, is to make it so accurate that the components last for 30 or 40 years and they're not losing their position or they're not becoming malaligned. So that's the goal with the robotics. Comparing this to our other joint surgeries, robotics is an advance. It's not the be-all and end-all. There still is a lot of human factors that go into using the robot. It's not autonomous. The surgeon is the one that controls the usage of it, but we are able to fine-tune what we're doing. And I think that in the long run, in 30 years, we may look back and say this was an amazing advancement.
The robot itself is a tool just like any other surgical instrument. So it still requires training, still requires a skill set, and it still requires your decision making. But the difference is that the robot gives you direct feedback and says, this placement is outside parameters. You get data before surgery, during surgery, and then data after surgery as far as how well you put the knee in and how well it's balanced. Any patient that would be a candidate for conventional total knee replacement would also be a candidate for a robotic-assisted total knee replacement. Where robotic surgery really shines are for those patients who might have a complex knee or a knee deformity.
It takes a bit longer to do the robot than a traditional way, so I would review that with the patient and explain what I think is best and what will be most efficient and be best for their outcome.